The first thing that I would want to tell you is IVF is basically a checklist. And you get a successful IVF journey only if all these points in the checklist are ticked off. The embryo, the lining of the uterus, the timing, the hormones, and many other related factors. If we have an IVF failure, then what are the points? What are those places where you might have got wrong? Basically, there are three things about it. First is an embryo. Sometimes even the best looking, the best graded embryo might not stick to your uterus. This is because just the fact that the embryo is looking beautiful doesn't mean that it is genetically or chromosomally normal. So if you have had an IVF failure, you have to ask yourself, were my embryos just graded or they underwent a genetic test, namely a PGT test? The second is about the endometrial lining. Even the best of embryos can fail if the lining of your uterus is either too thin or too thick, or the vascularity of the uterus is not good. Sometimes if you have polyps, you have some adhesions, you have some fibroids, then also the uterus cannot provide a very good environment for your embryo to sit. And lastly is about the hormones and the timing. We have to understand whether your thyroid hormones, your prolactin hormones, your sugars, they were all normal and the timing of your embryo was properly determined. So if you have to go for a proper review of your IVF cycle, there are a few questions you need to ask yourself. First, as I told you, was my embryo properly tested genetically? Number two, was the lining of my uterus properly monitored in regards to the thickness, any polyps or fibroids, or the vascularity or the blood supply to the uterine lining? Number three, was my uterine lining properly receptive at the time of my embryo transfer? That means, was my embryo transfer done at the right time? And lastly, the related factors like your clotting profile, your thyroid hormones, your sugars. They might not be the only thing responsible for an IVF failure, but they can often tip the balance towards a failure, right? So if the answer to any of these questions is no, please feel free to come to us and discuss your IVF journey.